Hi everyone, Whitney Lowe here, and welcome to another of our Clinical Insights videos, where today we're going to be talking about pattern recognition. It's something you probably don't hear about a great deal, but it's actually very important when we talk about the assessment and evaluation process. And I'm going to give you some hints, suggestions, and some great tips and tools that you can use today to help you in your process of assessing soft tissue injuries and looking for these particular patterns. So let's dive in and take a look at what we're going to be investigating here today. We're going to be looking at three simple type of evaluation procedures: active range of motion, or AROM, passive range of motion, or PROM, and manual resistive test, or MRT. We abbreviate them for short. Most of you have probably learned how to perform these procedures in your basic training, in your schooling. But one of the things that I have found over the years is that almost everyone was taught how to do these things, but what they weren't really taught was how to interpret the results and what they actually mean when they're evaluating the results with their clients. So that's what we're going to delve into today. It's the most important facet of these evaluation procedures, because you're not just looking for whether or not somebody has, minimal or lost range of motion. You're looking at what does the pattern of results tell you about which particular type of tissue might be involved in a particular pain complaint. And I have to tell you that so many healthcare professionals who focus on soft tissue disorders don't do this. And if they did, it would dramatically improve their accuracy in evaluating soft tissue problems. So if you want to take some time to really learn how to do this well, you'll get so much better at evaluating the nature of soft tissue problems and be able to help your clients so much more effectively. So again, just to briefly go over and review those three types of evaluation procedures. Active motion procedures are ones where the client performs the action completely on their own. There's no involvement from the practitioner, and the person is going through a full range of motion to see if they have any pain, limitations, or inability to perform that motion. A passive motion evaluation is one in which the practitioner moves the client's limb or body part through a full range of motion and is going to investigate if there, again, is any pain, limitations, or possibly something that you might palpate, like a crepitus or a grinding or grating sensation, or some other type of sensation that you can feel during that passive evaluation. One of the other things that's very important in a passive range of motion evaluation is what we call the end feel, or how does that motion stop at the end range of motion? Is it an abrupt stopping point that is because the person feels pain, or is there sort of a slow, gradual stop to the motion, or does it feel kind of mushy and like there's some type of soft tissue obstruction in there? These are all important characteristics of different types of end feel. We'll explore end feel in another video at a later time to look at what each of these things might mean. The third evaluation procedure is the manual resistive test, and this is sometimes called a muscle resistance test or something like that. This is an instance where we're getting a person to resist a movement, and we're going to try to see, is there pain or discomfort associated with it. Sometimes muscle resistance tests are used to evaluate muscle strength, which might be an indicator of neurological involvement. This is different than the way in which muscle testing is used in systems such as applied kinesiology, which is a completely different type of process. We're looking here predominantly for, does that resisted movement cause pain, or is there significant weakness associated with it that might be indicative of some type of neurological problem? Now, there's two other important concepts that I want to look at here when we talk about evaluating the results from these range of motion tests. I've got on the screen here a group of soft tissues. These are the major locomotor soft tissues that are exposed to injury that we're most likely to see. So going from left to right across the top, we've got muscle and tendon tissue, cartilage tissue like that inside the knee here, joint capsule. The joint capsule is richly innervated and is often a component part of many soft tissue pain complaints in certain regions of the body. Nerve tissue, like the ulnar nerve on the back side of the elbow here. Ligament tissue, like that, which binds these joints closely together. Fascial tissue and bursa. All of these are what we call locomotor tissues that might be potential causes of pain complaints that your client is experiencing. Now, James Syriac, who is one of the founders of the whole process of orthopedic assessment, sort of divided these soft tissues into two different categories. The first category is called contractile tissues, and these are basically just muscle and tendon tissues. They're the two tissues that are involved in the active contraction process that's moving a bone. We learned that fascial tissue in recent years has contractile cells in it, but those contractile cells aren't strong enough in their pull to actually move bones. So we're really focusing on just those contractile tissues that are strong enough to move a bone. So that is only muscle and tendon. And remember, it's the muscle that contracts, and that contraction in the muscle pulls on the tendon, which is attached to the bone and therefore causes the movement. Then we have what's called the inert tissues. And basically, this is just everything else. So cartilage, fascia, joint capsule, nerve, ligament, bursa, all of these are called inert tissues. We call them inert because they get moved, compressed, or stretched possibly during various movements, but they're not doing the work themselves. So we call them inert tissues. Now, the reason these two categories are important is we note that certain types of evaluation procedures will focus on the results from contractile tissues. Certain procedures will focus on results that might point at inert tissues. Now, we're going to take a look at another diagram here that'll help you sort of sort those things out and get a sense of how you can use that in the evaluation process. All right, so this is a diagram that we call the physical examination diagram, or PED for short. Basically, what it's telling us here is we might have pain coming from inert tissues. We might have pain coming from contractile tissues. And here's how the results from these different procedures that we looked at earlier might show up in those different patterns. So the green oval here first represents pain that's coming from an inert tissue. And what this tells us here is look at the types of evaluation procedures that are inside the green oval. And that is passive range of motion in the early stages of that movement, as well as passive motion near the end range. So both types of passive movement evaluations are inside the green circle. We also have active motion inside that green oval there. So what that means is if we have pain during active motion and pain during passive motion for the same movement in the same direction, there's a good indication that this might be some type of inert tissue pain that's causing it. Now notice the manual resistive test does not appear inside the green oval. It's inside a separate oval. It's inside this yellow one over here. So that means if we had a problem that was involving some type of inert tissue, we might expect to see a pattern where there was pain with passive movement, there was pain with active movement, and there was no pain with a manual resistive test because that MRT is outside of the green oval. Now, suppose we had a contractile tissue problem. That's represented here in the yellow oval. And this might indicate, again, if we had pain with a manual resistive test and pain during active motion, because both of those types of movements involve active muscle contraction. And remember, it's just the muscle and tendon tissues that are the contractile tissues that might be potentially painful. But notice also we have passive motion at end range also falling within this yellow diagram or the yellow oval here. What that means is you could have a contractile tissue problem that shows up during passive movements because you're stretching the tissue. So let's say, for example, you have an injury to the biceps brachii muscle. You can have pain with a manual resistive test when you resist elbow flexion. You might have pain during active range of motion when you perform a full range elbow flexion, which engages the muscle tendon unit. But you might also have pain during a passive movement, such as elbow extension, which stretches that muscle tendon unit. So a passive movement is likely to hurt, but generally only near the end range. And so that's why we've divided up the passive movements into end range and early range. So those are the patterns that we might see. We can use this physical examination diagram as an indicator for what types of problems might show up in different types of tissues and what might be the potential cause of them. So how do we determine from the active motion, passive motion, and MRTs the potential tissues that might be involved? We looked at that physical examination diagram, and that can certainly be helpful, but it still leaves us hanging trying to figure out which specific tissues might be involved. This is where your knowledge of biomechanics and kinesiology and anatomy really come into play. So for example, if you're doing a passive lateral rotation movement of the shoulder, you've got to know which tissues are being potentially compressed or stretched in which motions. Like at the end range of lateral rotation, you need to know it's the medial rotator muscles and the anterior aspect of the shoulder joint capsule that are getting stretched in that motion. Because if there's pain at that end range, then you'll think, okay, what are some of those tissues that might be causing that pain? And then you look at where is the location of that pain, and you can get a better idea if those tissues are potentially the ones that are driving that particular problem. So this is a really important part of the process, is to get a good sense of your anatomy and applying the biomechanics of what's going on with each of these individual movements and conditions, and what type of tissues might be involved actively, passively, or during a manual resistive test. So you can see, again, all those things that you tried, that you had to memorize in school about muscle actions and anatomical locations and structures. Maybe you haven't used that stuff a whole lot, but if you want to get into assessment and get really good at it, this is where you're going to use that stuff extensively. So again, I just want to emphasize why this process of pattern recognition is so important. You are in a position to help so many people who come to you with pain and injury complaints, but you can't do as much with them if you can't identify the nature of these problems. Now, sometimes there's a problem that's not caused by a local tissue injury and some type of local tissue pain. That's going to come up in your assessment and evaluation process as well. But if there is a locally induced nociceptive pain problem in a specific tissue, this type of pattern recognition work with your assessment processes is going to be so valuable and so helpful. And I'm telling you, if you get good at just doing this real simple process, this is going to take you so far in being able to give great help to your clients who come to you in pain. So if you want to learn more about these types of processes, including lots of different orthopedic conditions, what are those patterns that show up for those particular types of conditions, we delve into that content in great detail in our orthopedic massage courses. So come on over and visit us at the academyofclinicalmassage.com, and you can take a look at those courses and get a great deal of help and benefit in learning what these patterns are and learning how to recognize them so you can better help your clients. Be sure also to click on the like button and subscribe to our videos so that you can keep up with all the current information that we share with you about massage applications for treating orthopedic and soft tissue problems. Okay, we'll see you in the next video.